All right, welcome everybody. Today we're going to be talking about a drug that we like to use for pain relief. Really works good for relaxing muscles. It's Ketorolac, or better known as Toradol. So with that being said, again, Acular or Toradol is the main one, and we get this a lot in the ED. When you're doing your clinicals, obviously first semester, you're going to be definitely probably given this a lot. They like to give this one IM or IV. Again, it's used for short-term management of pain, and it's not a narcotic. That's the reason a lot of the docs like to give it. It is an NSAID. It's an analgesic. It also reduces fever a little bit. So again, it just it's 300 times the effect of aspirin. So it's kind of like an aspirin on steroids. And usually it's 8 to 10 milligrams of the equivalent of 8 to 10 milligrams of morphine sulfate. So with that being said, it takes about 10 minutes to onset. I know I've had it for back spasms, and I can tell you stuff works great. And again, it usually lasts around 2 to 6 hours, sometimes even longer. Now, again, it's a relief of moderate pain, and again, it's used in renal colic. It's actually really good for renal colic. So again, kind of the same side effects for any of the non-steroidal anti-inflammatories here. A little bit of nausea. It can cause a little bit of drowsiness. It can give you a headache a little bit. It can send the blood pressure up or down. And again, you got to watch out for an anaphylactic reaction to it. Just they'll get a little bit of rash with it. So when we do not give this, if they're already taking a high-powered NSAID, stay away from it. If they've got any type of renal problems, we definitely want to stay away from it. History of nasal polyps, angioedema, kidney dysfunctions. Again, it's metabolized in the kidney, so obviously we want to do that. Patients in active labor, we want to stay away from the Toradol. And again, so with that being said, given IM, it also has a little bit of a diuretic effect, so it'll start to pee just a little bit more. And again, we usually give a little bit less to the older folks on this. The solutions usually should be a clear solution, might have a little bit of a yellow tinge in it. Again, 15 to 30 milligrams IV, usually over 1 minute. We can also give 30 to 60 IM. That's your dosage there. And again, if a little bit less, if they weigh less, again, use a lower dose on these guys. And for kids, we just don't use it for the pediatric dose. The big way we give this is either IV push or IM. And again, the pregnancy class, it will cross the placenta and may cause some fetal damage. So, but again, most of the time, this is actually usually a pretty safe drug as far as that goes. All right, that's the quick overview on Toradol, and I'll see you guys next time.